With me now is Dr. Mike Haddad. He is the Chief of Staff at Bluewater Health. He joins me now from Sarnia, Ontario. Doctor, good morning to you.
Good morning.
So interesting to see that your hospital is at capacity with ICU patients, and most of those people are unvaccinated. Tell us more about what's going on in the hospital and really what you're hearing from those people once they find themselves in there with COVID-19.
We've seen a steady increase in the number of COVID-related illnesses, especially since Christmas time. We've doubled our cases from 17 to 41 today. In the ICU, where we have 14 high acuity beds in the ICU, 10 have COVID disease. The majority are unvaccinated, unfortunately, but when you look at the hospitalization in general, it's about 60% unvaxxed, 40% vaccinated split.
And are people expressing regret about not getting the vaccine? I mean, doctor, what are they saying to you when they find themselves there in the ICU?
It's a mixed bag. I mean, the biggest issue is when someone is sick and they can't breathe or have pneumonia from COVID is to just treat them. I mean, vaccination discussions usually is delayed. Some do mention or ask for a vaccine at that point in time. Not everyone, but some do, even though we know it doesn't do anything at that state of the disease.
But at the same time, in Lambton County, where the hospital is, the vaccination rates are quite low. And I know that the hospital sent a letter to the community to urge people to get vaccinated and stay home. Are you seeing any uptick in the demand for vaccines as a result?
Well, our vaccine, I wouldn't say the vaccination is low. It's lower than the province. We have 83% of our adults vaccinated. In the province in Ontario, it's about 88%. So our letter was to encourage everyone to get their first shot at least, and also help us out over the next 2-3 weeks during this wave by reducing socialization and other mitigating measures as well. But we continue to promote and advocate for vaccination, not just boosters, but even the first dose. I think that's even more important.
And doctor, I know that you have also expressed concern about people waiting too long to come to hospital when they have symptoms. This is at a time when I think a lot of people are trying to stay away from hospitals. What's your message to people who are feeling sick but aren't sure whether or not they should come?
Yeah, we've had actually different kinds of patients, some who are just anxious about it, but they're not sick enough, but they come to the ER just to have a confirmatory PCR test. Meanwhile, we also have patients who are very sick and are avoiding coming in the ER, and they come in very late. So the message has been basically is, if you're doing well at home, if you have symptoms, isolate. Even if you test with a rapid test, isolate. Come to the ER, though, if you are experiencing more severe symptoms like you can't breathe, chest pain, short of breath, can't eat, dehydrating, so they need to come earlier.
Doctor, thank you very much for being with us this morning. Dr. Mike Haddad is the Chief of Staff at Bluewater Health in Sarnia.